Yes, thank you. One of my colleagues said it's on the 16th.
It sounds about right, of March, around that week. So maybe you better just check with the assessment office to get. I mean, you guys didn't get a confirmed date?
No.
We got the confirmed date. It's on 16 March.
Okay, so the boys didn't get the date? So it's 16th of March. Okay, I guess we can go ahead and start.
Okay, doctor.
So I wanted to apologize for last week. Just completely died on me. So I think we kind of stopped here. Just correct me if I'm wrong. Okay, they're talking about the exam. When is the exam? All right. So I guess we stopped. We talked about this concept of habituation and dishabituation. Basically, you know, when kids see something that's new and they kind of get a sense of it, it doesn't become new anymore. And so they're going to need less time as they get older to kind of figure out what's new and what's not. And that's something that we experience as adults. You know, you walk into a place and your eyes, you know, kind of scan, but you immediately go to what you haven't seen before or what looks novel to you. Obviously, the ability of your habituation indicates your brain integrity. So children who have impairment in their cognitive function have obviously less ability to do such a task. So we move on to categorization, and that's, you know, where you put things into groups to help you learn. So how is this knowledge stored and manipulated? So this is kind of the basic unit of organization, okay, is this category representation. So to understand that things can go in groups really helps to simplify the environment, okay? So you need to be able to recognize and note the difference and note what's similar, and then you move on to making a categorization. So again, perceptual discrimination and memory abilities. So these are simple needs that you require in order to do such a task. Again, requires brain integrity. And it capitalizes on the visual selectivity of infants, that they look at some stimuli more reliably than others. And there's a preference to look at new things. And this is called the familiarization novelty preference procedure, a memory for familiar stimulus and the ability to discriminate it from a novel one. So they looked at kind of trying to understand how, you know, infants can prefer things over others, right? So they looked at two procedures. One is called the sequential touching procedure, and one is called the generalized imitation. The sequential touching is done for children like age 12 to 30 months, so slightly older than the second one. And what happens is you present an infant with samples from two categories at the same time, okay? So for example, you present them with a cube and a ball, okay, at the same time. The variation has to be one, so you can't give them different colors and different shapes. So it's either going to be different, usually it's going to be a different shape, but of the same color, so it doesn't get confusing, okay? So you present them with a cube and a ball at the same time. And what happens is they will sequentially touch the things that they are familiar with, okay? So they're familiar, And so they will sequentially touch the things that they're familiar with. With generalized imitation, you present them with a model of the real world. For example, you present them like a dog drinking out of a cup, okay? Then you present them with different types of animals, cars, tables, okay? And what happens is these kids then, they saw you hold a dog and it was drinking out of a cup, then they will hold other animals and make it drink out of a cup. So it's a generalized imitation of something that they saw, okay? So this infers learning, that they have learned. Okay, they observed, they've learned, they've noticed similarities, and so it's this kind of behavior that infers that they have categorized. So what kind of categories do infants represent? Okay, so there's obviously different levels of inclusiveness. So they could look at global things, basic things, specific things, colors, forms, also based on like causality, like the physical concept, if it bounces, if it rolls, that kind of stuff. Okay, so it could be perceptual attributes or dynamic. Perceptual is how it looks and dynamic is how it behaves. So you can put, you know, all moving objects in one, although they look different. So like cars and trains and trucks, you know, they all work in the same way. They all have wheels, they all move. However, they look different. Perceptually, you know, putting all things of the same color or of the same shape together. And these are things that, you know, kids learn in nursery. It's grouping, you know, putting things together that look the same. So there's a difference between category formation versus category possession. So you can form categories, but then in order to really understand them, it's a higher level of cognition, okay? So in this, you know, kids use being familiar to novel and being interested in novel things. Obviously, older infants have more real world experience, and so they kind of tap into their previous knowledge of things that they've already seen. There's something called perceptual schemas and image schemas, okay? So perceptual is from how things look, so their appearance, and then image is based on function, and it really involves the understanding of meaning. How are you going to categorize trains, buses, trucks together, although perceptually they look different? It's because you understand the meaning of the fact that they all have wheels, okay? Or actually, or grouping all four-legged animals together, because they all have the same function, okay? So it needs kids to be a little bit older in order to understand that. I think this is the last slide for this lecture, and we will move on to the second. Okay. Are there any questions from the previous lecture, please, before we move on?
No questions, Doctor.
Okay. Are you keeping an eye on the chat?
Yes, I am.
Okay, thank you.
You're welcome.
All right, so part 2 is infant cognitive development. This is part 2 of this set of lectures. So this will be your 5th lecture, okay? So when we finish today, we would have done 5 lectures. Okay. So we're going to look at a number of milestones in the area of cognition. Okay, so here you'll find that there's a summary of things we've taken before, but I'm sort of just putting it together in the repetition and sort of recategorizing it so it's easier for you guys to remember. Okay, so these are 4 concepts that are really essential when you want to understand language. Now, the people who work with this in depth are speech and language pathologists. When I receive a child for an assessment, usually they're brought in because the parents have a concern about language development. So my job as a clinician, whether you're a pediatrician, a family physician, I guess any specialty at all, you know, you need to be able to recognize when you're dealing with kids if their language is on, you know, right on par, or if there's a delay. But in terms of like diagnosing the problem with their language, that's really not our job as medical clinicians. It's more for the speech and language pathologists. But your role is essential in identifying that if there is a delay. So if you have a 4-year-old who comes in there and they're barely speaking single words, obviously you know that there's a delay, okay? But I go further, okay, in the assessment, and I ask more questions. So uh, onset of speech. Now we know that you know, kids by the age of 1 should have some single words. By age of 2 should be forming 2-word sentences. Okay, so is just knowing words enough to say that a child has, you know, reasonable language? So it's not just the words, but actually knowing the meaning of the words. Okay, so the semantics. So what do words mean? So if a child, you know, calls every time they see water, they call it milk. Okay, so that's not an appropriate meaning for that word. If they know how to use verbs appropriately, so the meanings of words, then the grammar is how are these words combined? Okay, are they combining them in a way that actually makes sense? Obviously, you know, no child at the age of 2 or 3 is taught grammar, but it's how they hear you speak, and that's how they form their sentences. So generally we advise parents not to do the baby talk, although it is very cute, but it doesn't help children in development of language, because you know, when the child sort of mumbles or babbles out at you, you want to talk back at them in normal language, because that's how they're going to learn. If you're going to like talk back at them in like their same babbling, then there's no progress. Okay, so that's also how they learn how words are combined. And I've seen some parents use very weird combinations of words that actually sounds foreign. Like it's as if you are, let's say you're speaking Arabic to a non-Arab speaking person. The way that you put the words together is not the same as when you speak to an Arabic speaking person, right? So the grammar is different. So you want to make sure that the words are combined appropriately. Okay. The phonology is something that we've kind of, that's how you learn how to read, is to recognize the auditory unit of a language. So what does it sound like? What does it mean? How do you combine it? And then the pragmatics is how do you communicate? Okay. And it also involves things like, you know, body language, like your eye contact. So these kind of things all are in pragmatics. So the speech and language pathologist is the person that will, you know, diagnose the problem, like where is the issue. So again, so when I see a child who's, you know, delayed, so I'll ask them as to when speech onset was, number of words that parents think the child has. Is this child combining these words in sentences? For example, obviously not a 1-year-old, but you know, a 3 or 4-year-old, because that's usually when they come in. Usually by the age of 3 is when parents are concerned about language delay. Okay, because they usually give them from 2 to 3 to pick up. But you know, if the child is 3 years old and there's just only single words, then that's a concern. So then I ask them if they understand words. So sometimes they don't know, they're not speaking the words, but they understand. Okay, so I'll ask them so for example, like if a parent tells their child, you know, bring me the cup of water without pointing. Okay, because if you point at the object and you ask and you kind of say words, and the child doesn't know what you're saying, but they can see you pointing, cognition is fine. They'll figure out that that's what you want. So we always ask, you know, will the child understand that you bring them something without you pointing at it? Okay. Does the child understand a set of instructions? Again, you're talking about 3 or 4 years of age, where, you know, you can tell the child, you know, go to the room, open the closet, uh, bring me a red shirt. So that's a complex set of orders. Again, it's testing language, testing cognition, and also attention, because you know, kids who are inattentive will kind of go to the room and come back not knowing what you asked them. Okay, so from birth to 6 months, communication is pretty much not very verbal. Okay, it's usually by crying, and the crying is responds to hunger, being sleepy or uncomfortable, and it progresses from cooing to more vowel-like sounds and syllables. So cooing is like pigeons. Okay, so that's how it progresses. In response to sound, newborns will blink, startle, cry. Okay, again, react differently depending on the affect of voice, the affective quality. Eye contact is made by, if you can send in the chat, by which month do you have eye contact? And then obviously the emotional information is derived from the speech, can then motivate them to attend. So if you are, speaking to a child and there's zero intonation in your voice, like there's zero affect, okay? You look flat and you sound flat. It's less likely that this child will actually attend to you, okay? Because there's just nothing to respond to. So moms that are depressed, or those that are, moms are schizophrenic, where there's not much affect, and even the sound is quite flat. So you're not going to get much of an interaction with an infant, okay? So when is it that we have eye contact? Anybody? Let's see. Yeah, so 4 months. So around 3 to 4 months, that's when you start to have eye contact. Obviously, we said because of the visual acuity. When do you have a social smile? When do they start smiling at you? Anyone? Social smile? Anybody knows when infants start to smile? So it's around 3 to 4 months as well. So 6 to 8 is a bit late, but it's a good guess. So around, again, 3 to 4 months, social smile, eye contact. And so a good question that we usually ask moms who come in with kids who are delayed or who think that the child may be autistic is, during the breastfeeding process, did you notice their eye contact? Okay. Some moms will tell you as young as, 4 or 5 months, this child is not really looking at me when I'm feeding them. So some moms are really perceptive. Okay. Thank you for those who contributed. Okay. So perception of speech is an early acquired milestone. So it's the ability then to tell between different vocal sounds and the contrast, that the phonemic contrast. So telling the difference between P and B is a very common one, not very easy to distinguish, but depending on, again, the perception of speech. Infants are born with a universal ability to perceive language. Okay, so it's a skill that is easily acquired, and so some kids are born into like multi language environments. So English and Arabic and I don't know, 2 or 3 other languages. So what do you think regarding the development of speech for these kids? Are they going to be delayed? Are they going to speak early? Are they going to speak on time? What do you guys think? If you're born into a home with like 3, 4 languages, let me know on chat. So they speak early, they speak on time, they speak early, they speak on time. So it may be actually that they're delayed, okay, in production of language. And that's a common problem. And so parents bring this child in. At home, there's 2, 3 languages, and this child is still not, they have good comprehension. So they understand the languages, but they're not speaking. So the recommendation that's usually made is what? Yeah, so someone says late, but they will speak all of them. So generally, the recommendation, thank you, Sarah, is to use one language. Okay, Sarah and Abdullah. Use one language until this child has, mastered it, like they're they're good with it, and then introduce the other languages. But like someone said earlier, they are storing all these language skills. Once they master one, likely the rest will follow. Okay. So even by birth, kids have linguistic experience because they've learned characteristics of mom's voice. And then we remember we talked about this, that, you know, kids will just hearing mom's voice will react. And they show a preference for mom's voice. What language should you teach your children? What age should you teach your kids other languages, or each person speak? So there really isn't an age. Once they've mastered one, you can then introduce more. Okay, and it depends on the child's ability. So again, some kids are really good with languages. You notice yourselves, you know, some of us are you know, we learn languages easier than others. It depends on, you know, which part of our brain is like more dominant, and if the language areas are more active. Okay, and for some people it's really hard to learn, you know, languages, so it's a skill. Okay, so once they've mastered one, you can introduce others. The idea of each parent, like if you have you know, two languages at home, you know, and then one parent just speaks one language, the other one speaks the other language, it can work for a lot of kids. With some, again, you can have a bit of delay. Okay, so I'm not saying that if you have more than one language at home, speak only one. This is only in the case if you have delay. All right, and some kids, again, if you have a lot of languages, they speak on time, but the general sort of trend would be a little bit later, unless you've had your own experiences. You know, if you're raised in a house with more than one language and you had no delays, then that makes you pretty smart. Okay. So by 6 months, they're able to recognize well-formed phrases and sentences. Okay. Always remember, recognition does not mean that they understand. Okay. Recognize means they note, they may look at because it's familiar. Okay. They learn about speech sounds and connect with what they see. So they connect what they see with what they hear. So, you know, you show them an apple, you say this is an apple, and so then now that they know that this is an apple, you don't want to ever experiment and teach your kids the wrong name for an object. You know, you don't want to do that. So early word learning, so learning associations between the sound pattern and the meaning. Okay, so knowing mommy, daddy, apple, milk, so just the nouns. Okay, and that's how they start to learn, you know, the single words. Then you have language perception, so detection of subtle properties of speech. Okay, intonations, knowledge about rhythm in speech, linking speech sounds to facial movements that form them. So again, when we're talking to younger kids, it's really important to maintain eye contact and talk to them, you know, like face to face, and not like, you know, while they're running here or there. Obviously we do that, but like in terms of learning, it's really important that they actually see your mouth as it moves while you're producing the words or the sounds, and helps them learn the names of common objects. So 6 to 12 months, so we finished birth to 6, now 6 to 12, all right, they start to produce something called canonical or reduplicated babbling. So babbling. You have babbling, both verbal and sign. So sometimes you can, kids who are not of normal hearing, you can still introduce to them like sounds by signing. Okay, and their acquisition depends on your input. Okay, so even kids that are normally hearing, if there's no stimulation in the environment, they're not going to acquire language. By 11 months, it's called variegated, and they kind of string syllables, so vowels, nouns, vowels and consonants together, and it kind of sounds like gibberish, but you know, eventually it transforms into words. Kids that are young, like 6 to 8 months, are able to discriminate most speech sounds regardless of the relevance to their native language, okay? This is not the case in the older children. And what that means is when you're younger, you're kind of discriminating the sound, but not really focusing on the meaning. As kids get older, because their focus is more on the meaning, they lose that ability to just focus on the sound, okay? Because now the interest is more in the meaning. And that's, again, the whole process of learning. You know, you hear all this sound, you can discriminate sounds, you know, words that sound alike or may mean the same thing based on what you see, you know, expressions, but you may not understand what it means. But then you start to know what words mean. And so then you start to focus on things that you understand, okay? Can you explain speech sounds, please? Okay. So speech sounds is how speech sounds, okay? So it's like how words sound. So it's more about not the meaning of it, but the perception of sound. Okay, so you're listening to a language that you don't understand. For example, you don't speak Italian. Okay, so you're hearing this language, but you're picking up on things that sound the same. Okay, and they're used in the same kind of context, or a word that's used, and every time it's used, you see a facial expression. Okay, so you connect. So your focus is on the sound of it, but not understanding it. As you get older, you learn the meaning of, so it's not the phonology, okay, not the phonology, which is the auditory, like how it sounds. It's more about the meaning of it. And so your focus becomes more on the meaning and less so on the speech sound. Okay. So infant speech sound categorization, so categorizing how speech sounds like, is influenced by common phonemes that they hear. So phonology, okay, common sounds that they hear, and then they start to categorize, okay? So infants learn about language by picking up on the regularities in speech, than actually by being taught. So they pick up on speech being regular, they can encode sounds and often follow the sequence that they come in. Again, try to imagine that you're listening to language you do not understand. Okay, so you're really focusing on sound, the auditory unit of the language, and trying to make sense of it more than actually understanding what the actual word means. So this is kind of the beginning of, like, when you first learn how to read, okay, you see these letters, but you don't know what they mean. Then you start to learn the phonics, okay? So the C and the K, all right, a lot of us had issues with, you know, cats that sounds like a K, but it's written with a C. And so a lot of times they will focus on the sound, not what it looks like, okay? So you learn the K sound and the various sounds, and then you start to understand the language, okay? So here, the focus is on the perception of speech, the sound, okay? And then there's a perception, obviously a preference for familiar over non-familiar sounds. Okay, so we're talking here about children under the age of 1. So they're not yet verbal, okay? Towards the 10th or 11th month, when they start to produce words, you know, like we said, 11 months, it's more like this variegated, you know, putting together nouns, sounds, you know, vowels and consonants. But by the age of 1, they will produce these words that they understand what they mean, okay? Earlier on, a lot of kids will say mama when they mean baba, okay? It's still confusing to them, but it's just the sound, okay? So segmenting words from fluent speech. So if you're learning a language and you've understood some words, okay? So you understood some nouns, some verbs, all right? And then these are in the middle of other words that you don't understand. So obviously when you hear it, you will pick up on the words that you do understand. So you can segment these words from fluent speech. And again, we advise parents, if their children are a little bit delayed, to what? What do you advise them in terms of how they produce their sentences and their language with a child who's, you know, a little bit delayed? What do you suggest? Long sentences, short sentences? So more like short sentences, yes. Okay. So if you have a child who's a little bit delayed, you want to make sure that you maintain eye contact. You look them in the face while you're talking so they can see your mouth as it moves. You want to use short sentences, okay? So that they can pick up on the words that they understand from a short sentence versus a salad. You know, if you like talking in long sentence, it's just kind of like a salad of words, really hard, much harder for them to pick up on words that they're just learning. So by the end of the first year, they have this reduplicated babbling. They're able to follow a point. Remember when we talked about joint reference, which is really essential because this is the beginning of social connection, cognitive connection. They can distinguish sounds from, you know, others, and they can segment words from fluent language. So distinguishing sounds, again, doesn't mean like it could be words. It could be, you know, knowing that that sound is my mom's voice, that's my dad's voice, that sounds like a cat, that sounds like a dog. So distinguishing different types of sounds and knowing, you know, that that's what it is. So distinguishing is not only perception, but also comprehension and segmenting words from fluent language. So from a year to a year and a half, you have a rapid acceleration of acquiring new words. They're saying like 9 per day. So you can imagine, like at that age, they're like a sponge, right? But usually, you know, parents may not pay attention to how much kids can learn because they're so tiny. You know, it's just a year old, but they can learn as many as 9 words a day. They start to use words in a productive way. They learn to use words in context. So words in a way that they can combine them grammatically appropriately and can communicate them also appropriately. Social pragmatic understanding, they're able to start to ask questions. They're following point and eye gaze, okay? And then following gaze is between 12 to 18 months. So these are important milestones for you guys. I'm just kind of reiterating them so you don't forget them. So learning new words in comparison to ones they already know, okay, might infer that they understand, okay? So here we're talking about words that mean the same thing, although they are not the same, okay? So it's kind of a categorical induction. If they learn a word, they can learn how to extend it to similar objects, for example, based on shape. So they can understand a meaning by kind of induction, okay? That some words mean the same thing, but can be used differently in a sentence. So this is what we call grammatical understanding. So recognizing parts of speech, utilizing grammar to discover meaning. So this is an example. When I say this one, again, blickish and blicket are not real words, okay? But when I say this one is blickish versus when I say this one is a blicket. Now you don't understand what blicket or blickish means, but when I use it in that sense, what is the first and what is the second? So this one is blickish in terms of language and grammar. Am I describing something or am I like naming something? So for the first, this one is blickish. What is this? So thank you, Sarah. The first is an adjective and the second is a noun. Okay, although it's the same word, okay, so the child does not understand what blickish or blicket is, but the way I'm using the word in the sentence. So this one is, all right, or this one is a, okay? So understanding, this is again induction. Understanding word order is called syntax. So like understanding how words are put together in terms of order, okay, is called syntax. And then understanding like a question. So when you ask them a question, do they know that you are asking them something? It depends on how you put the words together, okay? And again, the younger the kids are, it's really important that you use language in a very clear and defined way, all right? So that they kind of don't get lost in translation. All right, I'm going to move on to memory development. So we're done with language development. We go on to memory, okay? So again, in chat, when do you think is the youngest age where you can actually remember? Like how far back, how young are you to remember, you know, anything that happened to you in your life? What do you guys think? When do you start to have memory? Okay, 4 years old, maybe two to three, okay. Now, is it a number or does it depend on something? Like it's really tied to a skill, a particular milestone. What do you need to have? Someone says emotion. Emotions are there, you know, we talked about basic emotions are there from birth, okay? Cognition, okay? What about cognition? Like what in cognition? What is an essential awareness, okay? What do you need to have in order to be able to have memory? Okay, mental development and event. Obviously, event is essential too. So it's really tied on language. Okay, so it's very hard for you to be able to remember things in the pre-verbal, you know, part of your life before your language develops. Okay, unless it was a traumatic event. So if you were like at the age of 3, you got lost in a park or something for like hours, the trauma in itself it kind of imprints a memory of that, okay, even though you couldn't speak then. So language development is essential here, okay? So early experiences are fundamental to your social, emotional, and cognitive development, okay? But we barely remember a lot of events that happened to us in childhood, okay? And the sort of the limiting factor is, we'll learn in a bit. So causes of childhood amnesia. Why is it that we cannot remember things that happened to us like when we were really young? Okay, so Freud also always has to come in with something, and we're going to talk about Freud in lectures to come. So his kind of theory of repressed memories was largely discredited. Okay, because again, there's no access to these memories if you don't have language. So language is essential here. So the development of a sense of self. So visual self-recognition. Remember that test where the kid was looking at themselves in the mirror. So by 18 months, there is visual self-recognition. As language skills improve, they start to better understand themselves versus others with pronouns such as I, me, and you. So that distinction is essential. Okay, so understanding or like recognizing yourself and that you are distinct from others. Okay. Now, language development, memories encoded before language develops are very difficult to retrieve. So usually, again, language development, so around the age of 3, 4, pretty much by 4, you know, your language is, you know, fully developed. So it's harder to retrieve things that are younger than that, okay? And it's almost impossible to retrieve them in the pre-verbal phase of life, unless, like I said, it was like a major traumatic event. So here you really rely on how your parents give you a detailed account of the past. Okay? How do parents tell you about your past? How do you know about your baby years? What is one of the, you know, very common, very effective ways of knowing about your baby years that you have like all over your house? especially if you're the firstborn, there'll be like millions of these lying around. If you're like the lastborn, probably none. Okay, so pictures, yeah, photos, pictures. So usually first videos, I mean, again, if you're born like these days, but if, you know, like born like, I don't know, your parents, I don't know if they had videos then, but generally, you know, like visual evidence, okay? So like I said, firstborns, if you're a firstborn, you know that your pictures are all over the place because your parents took a picture of you every single second of the day. And if you're like number 4, 5, or 6, you know, not sure if they had the time. Obviously, they had the interest, but you know, the excitement. Okay. So your like memories are pretty much based on your parents. Like they'll tell you, oh, when you were like 2 years old, you used to do this, because you have no clue what you used to do when you, and they could be telling you something that never ever happened, and you wouldn't know if it did or didn't. So it's parents providing the detailed accounts of the past. Again, that's why I love working with children, because you know, I don't have issues with memory because parents are right there. They'll tell you everything about the child. Whereas when you're working with adults or geriatrics, there's nobody there to give you an account of this person's childhood. And why is that important? Like, why is it important to know about people's childhood? It just depends on the problem that's being presented. If someone has, you know, a long-term or lifetime history of poor relationships, interpersonal problems, you really need to know about how this person's childhood was. So again, another bonus for working with children is parents just come in and tell you everything. So language is essential. Okay. Okay. Somebody wants to say something? So neurological deficits or immaturity, brain immaturity, affect how information can be stored and how it can be accessed. Okay, so again, children with global developmental delay or who develop a brain insult, whether it's a head injury or seizure disorder or, you know, God forbid, cancer, like brain tumors. So these kind of things impair, obviously, memory, in terms of storing information and retrieving it. Okay, so these are causes of why it's hard for people to remember things early in childhood. So the most kind of reasonable or sensible, because it's with everyone, is you know, language. Not everybody has neurological deficits, but it's something that would explain. Now we're going to talk about Freud's and all sorts of defense mechanisms and repressed memories when we talk about Freud. So that will be interesting. So how do you assess memory in infants? So you have, you know, kids that are 12 months old, 24 months old. Can you assess their memory? Yes or no? Okay, somebody raised their hand. Can you put it in the chat, please? All right, no, 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 yes, no. Can you assess memory in infants? Okay, I'll go for a yes. Okay, no. Okay, why no and why yes? Why can't you assess memory in infants? I know we talked about language, okay? But what we're saying is you as an adult, you will not retrieve pre-verbal times of your life because you didn't have language then, but now you're assessing an 18-month-old. How can you tell if their memory is intact or not? Can you? So it's based on recognition. So if they recognize, and if recognition is inferred, that means that they remember. So there is a memory for an event, a memory for an object. Okay, so it really depends on recognition. Okay, like I said, you know, the Bailey's the assessment of intellectual abilities is done from the age of 4 months. So from the age of 4 months, you can assess, you know, functions, cognitive functions. Why not before 4 months? Why not 1 month or 2 months? And again, we talked about, you know, visual acuity, eye contact. So you need to have some of that before you can start to assess any kind of function. So again, major obstacles, language, but memory is inferred through observing behavioral changes. Okay, so when the infant's behavior changes, that indicates something that you will observe. Okay, so there are actually procedures for testing memory. There is the visual paired comparison task, there's operant conditioning, and there's deferred imitation. So memory is inferred when behavior changes are seen. Okay, now operant conditioning, we're going to take that when we have a whole lecture on learning. Okay, so we're going to discuss that in another lecture. Okay, so there's two kinds of memory. There's recognition memory and recall memory. Okay, so recall memory is remembering something that happened. All right, so it's information retrieval in the absence of cues or prompts. So it's an infant doing something without you having to kind of prompt them or cue them. And it's tested by deferred imitation. So you have shown this infant that, again, we're talking about, let's say 6 months, maybe closer to a year, all right? Like a dog drinking out of a cup, okay? It's part of your play, okay? So deferred imitation means that they will act it out, but not instantaneously, maybe a few weeks later. So a few weeks later, you kind of put these toys in front of the infant without prompts or cues, meaning you don't directly put, you know, the dog or the cup right in front of them. They're just right there, you know, in the environment. And so what happens that you can say that there is a recall is when the infant actually then holds from the middle of all of these toys, they pick up the dog and they try to make it drink. Okay, so that means that they are basing this on something that they have learned, because if you present it for the first time, they don't know, right? They don't know that, like, you know, this will drink out of that. It's not something that they know. And we show kids, right? You know, that cube where you put the like the ball inside the hole that's round, the triangle inside the one that's triangular shape. Now, I don't know if you've ever seen like your mom play with your siblings, or you played with your younger siblings or cousins or whatnot. If you present an infant with that and not do anything at all, they're not going to know what to do with it. They're going to just trial and error, push things here, there. But if they see you do it a few times, okay, then later on, it's in their environment. They will reenact, they will repeat because they have learned. Okay, so this infers, or let's say confirms, that there is such a thing as recall. They do remember something, okay, that they have seen before. So because we know that, so as, you know, adults or parents, it's really important that you be careful what you say and what you do in front of kids, because they will register and then they will recall and they will reenact. Okay, so if, again, parents are not very careful with the language that they use around their children, you know, okay, he's a toddler, 12 months, you know, 24 months, they're like picking up, we said from 12 to 18 months, they're learning 9 words a day, right? So these 9 words a day could be very constructive, you know, good words, or they could be like really nasty, not so great words. That they will like reenact later on when they're frustrated and they saw you, for example, as a parent, like slam something or kick a chair. I mean, they observed you do that, okay? And they've associated that with your face that looks angry. So what does that kind of reflect on them is when they're angry, they will do the same. They will kick, they will hit, they will smash. So when parents come in with a child that's aggressive, okay, and they're wondering why this child is aggressive. So what is the thing that you want to do in terms of assessment? Okay, you want to assess their environment. You want to assess how is it that parents deal with frustration. You know, what do the mom and dad do when they're upset or angry? Okay, so if dad is somebody who's losing his temper, or mom is somebody who's usually swearing or slapping, okay, her kids, so then this child is aggressive. So obviously it's recall memory. They are recalling things that they've witnessed in their environment. They're reenacting it. So, you know, thumbs up, this kid's recall memory is great. Okay, so absolutely intact memory. So then we need to work on not this child. So we're not going to punish this kid and put them in the naughty chair. We're going to punish parents and put them in the naughty chair, because they have to be more aware of, you know, their behavior, because it's absolutely reflected on their child. Okay. Now, recognition memory, okay, is measured by the visual paired comparison task. So I'm going to explain that. It involves judging if an event has happened or has been experienced before. Okay, it's inferred if the infant fixes on novel stimulus. So you acquaint the infant with an object, whatever, like a ball or a cube. You kind of show them that one stimulus, and it's kind of like, you know, there, it's around them, right? And then a few weeks later, you present them with that familiar cube and then a ball. Okay, so what happens is they will fixate on the ball because they've not seen that before. So what that infers is, okay, they've recognized, so obviously they're going to scan, they've recognized the cube. Now they're looking at the ball because it's new. So that infers that they have recognized. So this is recognition memory, okay? Now, if they look at both of them the same, okay, it just means that they forgot. So forgetting is inferred if the reaction, if they're looking at the two things in the same way, then okay, they both look new. So that means that they forgot, and that happens, you know, you know, infants, like little babies will forget, okay? It's not the end of the world. So then you try to kind of try to like work on that again, and you know, get them familiar with something, and then try again to pair it with something that's new and observe. Now, if this is a repeated theme, okay, either that, like if every time you kind of get them familiar with something, and then, you know, soon after it's like they forgot. So either that the time, that the sort of the interval between you getting them familiar with something and then showing them something new is like way too long, where, you know, they've just moved on, or that there may be a memory issue as well. There could be a memory problem, which could mean, you know, is this child developmentally delayed? Is this child, you know, do they have ADHD? Because parents of ADHD children will number one complain from memory, whether it's recall or even recognition. You know, like this child, 5-6-year-old, they know that every day they have to do the same thing, or they know that that is right, that is wrong. So it's they should recognize. They know that that's dangerous. So, but then they forget. Okay, so forgetfulness could indicate, you know, more CNS affection. Okay. So you teach them and ask them. Okay, I'm not sure if we're talking about the same thing. History, environment. Yeah, I'm not sure if we're not in the same. All right, so are these clear? Recognition and recall memory? Is everybody okay? Today's a very short lecture. This may be sort of, we're coming to the end. Okay, okay, yes. Okay, so obviously you know that a single memory in the brain is made up of multiple events. Okay, so many things go into the formation of a memory. Obviously many genes being involved. The medial temporal lobe is one of the most essential and critical parts of the brain when it comes to memory, okay? So you guys are much better than me in anatomy. It's been forever. So, you know, the hippocampus, parahippocampal gyrus, okay? So adults with damage to these structures fail on tests of deferred imitation. So remember what deferred imitation is to see something and then later on, without prompts or cues, repeat the same thing based on just, stimuli that are seemingly neutral in the environment, okay? So medial temporal lobe. Now, one of the types of seizures that affect the medial temporal lobe presents with psychiatric symptoms, and this is something that you'll take later on. So medial temporal lobe, not only memory, but also for psychiatric problems. So we see kids who present, for example, with psychosis. And so it's more of a medial temporal lobe epilepsy that presents in that way. So it's not that they're schizophrenic or like psychotic due to, a mood disorder, but it's more of a medial temporal lobe epilepsy. So that's why it's really essential when you work with kids. Like again, we think organic, we think of, brain structure that could be impaired if a child is presenting with psychiatric symptoms for the first time. So we're not going to label it as schizophrenia or mood disorder or whatnot, unless we've made sure absolutely that this child is medically fine. So right now I'm seeing this 14-year-old girl who has a very interesting and complex medical history, who 3 years ago presented with hypomania. So she's 14 now. So when she was 11, she presented with hypomania, meaning that her mood was completely elated. She's like super happy, but then there's fluctuation. So she'll go from really, really happy to being irritable, and she's not psychotic, okay? So she presents with this hypomania, and I think you're going to study that either later this year or next year, like bipolar disorder. Anyway, so she was started on treatment, improved, and then, they got off treatment. She then developed complex neurological problems, not related obviously to her mood disorder. So she has now some kind of optic neuritis, and then she developed Guillain-Barré syndrome, which is a kind of neurological, like a nerve infection, and she became quadriplegic. So quadriplegic is like she can't move any of her limbs, okay? And I was asked to see her yesterday because she's singing. Okay, this is a very traditional Saudi family, okay? So she's got Justin Bieber on her iPhone, like on super loud volume, almost attached to a speaker, and she's like singing Justin Bieber. And so we're called to assess, like, her mood. So yesterday when I saw her, she's very elated, very expansive, like any over familiar. So clearly hypomanic. But again, we wonder about seizure disorder. Is there anything going on? So we're in the process of investigating that, if on top of her other neurological problems, as well as medications that she could be taking that could present with like this kind of labile mood. So it's a really interesting girl. I'll update you about her. I'm going to go see her later today. So visual recognition memory is also based on the medial temporal lobe, okay? So these functions are present early in life. The pathways in infancy may be different than in adulthood, okay? So therefore, it could explain the lack of recall of early memories, okay? Plus the whole idea of language. So it could be that pathways are a little bit different in terms of memory encoding, plus the language. But again, medial temporal lobe is essential. So it's a very critical area for us in psychiatry. So long-term memory systems in infants. So you have two types. You have a declarative memory and you have a procedural memory. So a declarative memory is a memory of events. So things that have happened to you in your life. Medial temporal lobe structures are essential to be intact, okay, for these events to be encoded. But it's hard again to retrieve in nonverbal infants, okay? And so this is a memory of things that happened to you in your life. Language is necessary, as well as an intact medial temporal lobe. But procedural memory, okay, is a memory for habits and skills. Can you guys give me examples of habits and skills that you don't really lose if you have some damage to your medial temporal lobe? So even if you have damage to your medial temporal lobe, memory for habits and skills may kind of continue. So what kind of habits and skills do you think are difficult to forget? Anybody? Habits and skills that are a procedure, something that you learn that you may not forget. So let's see. Riding a bike is great. Washing your hands, possible, but riding a bike, right? How to eat. What about making a sandwich? How about making a sandwich? What do you guys think about making a sandwich? Is that a procedural? Okay. Yes, as in whistling, or yes, as in. So making a sandwich is frontal lobe. It requires like more of problem solving rather than a memory of. Okay, so things like riding a bike, driving, swimming. Okay, so sometimes making a sandwich can be a problem because again, it depends on you know, if you're a cook, you may not forget it because it's something that's like your everyday. But I think like riding a bike is something that you never forget how to do. Driving a car, okay, swimming. So these kind of habits and skills are those that even if you have some damage to your medial temporal lobe, they will not be affected. Okay, so those are long-term memory systems in infants. Okay. Thinking this may be our last slide. Okay, so that was our last slide. So any questions? Because next week we're going to start, you know, completely different because we're done with social and cognitive development. So those are done. Next week we're going to start with something else. I mean, I have to apologize. I'm just trying to put everything in terms of PDFs and lectures into one USB to send to Mr. Muntasir to upload. So I do promise that by Sunday that will be done because I want you to have all the stuff before, you know, a good month before your exam. Okay. So if there are no questions, I guess we can say goodbye and let me just check. One question. Oh, thank you, Doc. Thank you very much. Thank you all. Have a great weekend.